Hello students, APGT 2025 is nearing, so you might all be running in the revision session. So let us discuss regarding the MCQs related to planes of abdomen. So let us start with APGT 2020 question. Transpyloric plane passes through body of first lumbar vertebra near its lower border, body of second lumbar vertebra near its upper border, midway between sternal angle and pubic symphysis, and the last option, tip of 10th rib. So here you might have the confusion, somewhere in the lumbar vertebra plane might be crossing, but you may not be know whether it is upper border or lower border or exactly what is the number of the vertebra. These confusion might be there. So let us discuss that in detail, and the answer for this question is body of first lumbar vertebra near its lower border. Even someone might have arrived up to first lumbar vertebra, but you need clarity to give the answer as lower border. So let's see that in detail. So in case of transpyloric plane, here comes the transpyloric plane. So here it is in the tip of 9th costal cartilage, you can see in the image. And in case of vertebra, body of L1 near the lower border. So you can see here it is near the L1. So don't get confused if it is L2 upper border. Make it very clear, transpyloric plane in the L1, that too in the lower border. And it's not the 10th rib, it is the tip of 9th costal cartilage. So you can see this image. Next. So in transpyloric plane, what it crosses through? So we can see the pylorus of stomach, it crosses the duodenojejunal junction, and it crosses the fundus of gallbladder. Then comes the neck of pancreas. Then comes hyla of kidney and attachment of transverse mesocolon. Then comes the origin of superior mesenteric artery and portal vein. So you can imagine here comes the pylorus of stomach, and here comes the duodenojejunal junction. And in case of here we can imagine regarding the gallbladder, that is fundus. And if it is fundus, then nearby to is the neck of pancreas. And in the posterior aspect, we can imagine the hyla of kidney. And you have to remember the superior mesenteric artery and portal vein origin. Okay. So these are all the anatomical landmarks in case of transpyloric plane. Next. Next comes transtubercular plane. So you can visibly see here transtubercular plane. So what are all the things it is crossing exactly? It crosses through the tubercle of iliac crest. You can see here tubercle of iliac crest. Then comes body of L5. So make it very clear in case of transtubercular plane, it is near the body of L5, that to upper border. So in case of transpyloric plane, it is lower border of L1, and in case of transtubercular plane, it is body of L5 near upper border. So here only inferior vena cava begins also. So if you get any question where the inferior vena cava begins, you have that idea that it exactly begins near the transtubercular plane. Okay. Next, regarding the subcostal plane. So here it crosses the lower border of 10th costal cartilage and the body of L3, that too near the upper border. You can see here lower border of 10th costal cartilage and body of L3. So make it clear, L1 lower border transpyloric, L3 upper border subcostal, and upper border of L5 transtubercular plane. So this is most important MCQs. Then thank you so much. Please take notes of these vertebra numbers because you cannot search in the book at last moment. So if you have a note regarding these numerical values, you can see at the end, and these things will be the direct questions which will be guiding you easily. So thank you so much. Keep learning with us.